Hello, everyone. My name is Ian Hill with the Urban Institute. I'm a member of the Partnering for Vaccine Equity Learning Community team. Since 2021, the PAVE program, funded by the Centers for Disease Control and Prevention, has addressed racial and ethnic inequities in adult COVID-19 and influenza vaccinations. Within PAVE, the Building the Evidence Base for Promising Practices project supported 18 national, state, and community organizations with $25,000 grants to implement tailored strategies to address vaccine equity and uptake in their communities. These 18 PAVE-funded organizations developed, implemented, and evaluated the effectiveness of a promising practice in one of three areas: media-based outreach, community-based outreach, and vaccine events and partnerships. Target populations served by the selected organizations included Black, Hispanic, Latinx, East and South Asian, Middle Eastern and Arab, and American Indian communities, among others. I'd now like to introduce my colleague, Zara Porter, who will take it from here.
Thanks, Ian. Now we will have the opportunity to hear from three grantees: the Public Good Projects, Beacon Charitable Pharmacy, and Black Equity Coalition, and the wonderful work they did. Passing it on to Ian and his conversation with the Public Good Project.
We are here today with Melissa Dunn-Selesky of the Public Goods Project. Hi, Melissa. Great to have you here.
Thank you so much for having me.
Of course. Well, why don't we start our conversation with you telling us a little bit about your Promising Practices project and why you decided to pursue it.
We captured almost 34 million Spanish language COVID-related messages that had almost 600 billion total impressions. We saw that the highest level of the conversation was around COVID-19 generally, but we also saw things like "Yo no me vacuna," which is "I will not get vaccinated." We also fielded a single cross-sectional survey of Hispanic adults throughout the United States, looking at differences in attitudes by country of origin, primary language spoken at home, and some other demographic factors. So instead of looking at surveys that treat Hispanic adults as a monolith, looking at what is some of that nuance that we can suss out from our respondents, that we could use in communication efforts, that we could be using in our response to different pieces of misinformation, and what we should be thinking about in terms of language use. And then from the survey itself, we were tracking things such as preferred language when it came to discussing the Hispanic community. So in social media posts, would you rather see Hispanic, Latino, Latinx, Latina? Like, what language should we be using when we're talking to community? And we saw overwhelmingly across generations, across all demographics, that the number one choice was Hispanic generally, followed by Latino, gender neutral, or sort of seen as a gender neutral or standalone. Then Latina. We only saw about 4% across all generations who preferred Latinx. So looking at some of those terms that we've been incorporating more because we thought that they were more acceptable or preferred, we're actually seeing from the community are not the preference that they have in the type of content we're creating.
And I remember reading from your report that there was a surprising homogeneity in terms of language used around vaccine, mask, and whatnot. Does that make your messaging easier in the future?
It does, yes. So one of the things we looked at in the survey was really just showing people images of a face covering, of a vaccine, and saying, what language do you use? And we were concerned if we're saying vacuna, but a specific community is using a different word and what we're using doesn't resonate or doesn't translate properly, that then we're sort of making content that is unusable or meaningless. And we saw tremendous, as you were saying, homogeneity amongst use of terms. And that was very helpful because it tells us, here's the word. And if you use it, most people are going to understand it. It's really this like idea of cognitive testing your language. And it was sort of a relief. It did break our hypothesis, which is that we would find differences. And in having the null hypothesis proven true, which is that there are no differences or there was very minimal differences, it does help with content. It gives us confidence in what we're writing and hopefully makes sure that our content is as useful and usable as possible.
Excellent. So it sounds like you really learned some lessons that might influence your future work, and you've mentioned a couple of ways already. Are there any other things in closing that you'd like to add about this project, your findings, and how it might influence your work going forward?
I'll say that in the ensuing months since the project ended, we have put in place many of the things that we said were findings, right? So thinking thoughtfully about where our influencers are in creating content, what language we're using when we translate assets into Spanish or talking points into Spanish, and then thinking about this shift to negative attitude in addition to responding to misinformation specifically, and providing those resources around negative attitudes and responding to those to community and through the different resources we're creating. So these aren't just theoretical takeaways; they have very much been applied, and I hope to great success and to the benefit of the folks we're trying to help.
Excellent. Well, thanks for your good work and for all of the interesting stuff you produced.
Great, thank you.
All right, hello everyone. Today we are joined by Heidi Frischauer, Mary Catherine Jones, and Carol Rizzoletti from the Beacon Charitable Pharmacy. But could you dive a little deeper into the primary activities you conducted under the project?
We developed questions and then asked the community members about their perceptions of COVID vaccination, the importance of vaccination, the importance of having opportunities for vaccination in community settings, non-clinical community settings like churches and community organizations. We also asked people how they wanted to be involved and what avenues they saw for themselves to be involved, if they did, with supporting COVID vaccination in the community. The second main activity we implemented was the Facebook campaign. And we set out initially to look at how would posts that are specific to COVID-19 vaccination compare to posts that address whole health. And what that project actually evolved, and we ended up thinking about it more as how could we use Facebook to position ourselves as a trusted source of information at a time when there was a lot of misinformation about COVID.
And I would follow up with that to saying that, Heidi was very key in this project, but so were all of the staff in terms of we had a resident pharmacist and we had pharmacy students and so forth. And all of the staff were involved, but Heidi was the key, and her flexibility, her openness, her warm manner. And over again, I would hear, "Oh, did you give me a shot?" She would be able to do that so easily. And she got a reputation for being so gentle that people wanted to wait for her.
Did you want to discuss maybe couple of the main findings that you learned from the surveys and from the Facebook campaign, and what you hope to carry through your future work at Beacon?
Partnerships, they have been amazing. As I today, still going out into the communities, I often am getting people, tell me what you think about the new COVID vaccine. And so to me, that trust has been built with the people in the community. So that's been a positive experience.
And I think the steadiness of Heidi and the team, and we even had volunteers working with this, but and the partnerships was that so often we learned pretty quickly that, boy, it takes more than one time to educate with many people. Yes. And they might have come to that particular site Heidi was at 3 or 4 times, and then they finally say, gee, I'm thinking about having my vaccine today, And the other thing was the consistency of the message, We had a lot of people that brought up questions. Some really surprised me. There was, a lot of mistaken information out there. And it was wonderful that the team could be there and talk about, well, no, this is how the vaccine works, or this is what happens with COVID or whatever else. And recently, with being able to expand to trying to educate about all vaccines, adult vaccines and so forth, has been excellent.
One of the standout findings for us, in an environment where our numbers for vaccination were going down as they were nationwide, and it was getting harder and harder to find people who wanted a vaccination or were open to it. What we saw in the survey was that people strongly supported, or at least somewhat supported, having continuing to have vaccines available in community settings and being able to access health screenings like glucose and diabetes, blood pressure screenings in community settings as well. During the project period, we had started offering more health screenings to, again, build that trust with the community and show that they can come to us with any questions, whether it's about COVID or about their blood pressure or about infectious diseases, and we will be a reliable, trustworthy source that is in the community with them. So again, Heidi being the face of that trust was very helpful for us, but we were very pleased to see that the community really did support the fact that we have come out from behind the pharmacy counter and are now in the communities, in the locations where people live, work, play, and pray, and are able to access vaccines and other pharmacy services within their daily routine.
It was really great too about the Partnership for Vaccine Equity is that we did partner with the health departments, with the state, and we were part of a cohort across the country, and we learned so much from each other, and we built, relationships, but also, the old idea of team, or TEAMM, together everyone achieves much more. And we sure were able to do that. And I think that the partnerships we formed will go forward on so many different levels. So it's been fun. Besides feeling like we have been productive, we've been effective. And I think it pulled our team together around this issue. We have to remember too, at the time that we were getting involved in all of this, it was kind of scary. I mean, just generally, we were one of the few businesses open in our community, essential service, but, and to be able to find ways to reach out to the community that we hadn't been able to reach out to, was just incredible. Plus, I think it was a boost for all of our members of our staff as well as the committees to have that support of the other organizations. And truly with Zoom, it's amazing across the country, with our cohorts and just nationally with all of the organizations that were participating in the Partnership for Vaccine Equity. And I really believe that all of these partnerships, no matter what goes forward or what the concern may be in our community, I think these partnerships are going to serve very well long after, Beacon maybe being the force that brought them together. I just think all of those partners are going to come together however they can when something else comes up. Hopefully not a pandemic, but, any issue that our community may have.
So we just want to say thank you so much for sharing your work with us and the greater PAVE learning community. And that will wrap up our conversation today. Thank you all.
Thank you.
Thank you.
Welcome, everyone. We are here today with Ayana King and Monica Malik of the Black Equity Coalition in Pittsburgh, Pennsylvania. Good morning to both of you. Why don't you tell us a little bit about the major activities you engaged in during that time span?
So we wanted to make sure we outreached and were intentional about our outreach into the Black and Brown communities. So, we participated in vaccine clinics, but in order to get the information out there, we had flyers, we had social media posts, we used X, formerly known as Twitter, we used Instagram, we used Facebook. We made sure that we were intentional about even the characters, the people that we used in the ads, because, representation matters. So, making sure that people saw themselves within the ads that we had. We also used newspaper ads with the Pittsburgh Courier to make sure that we outreached into Black and Brown communities. We also worked and had ads with WAMO, which is a local urban radio station here in Pittsburgh, to make sure that no matter how people were getting and absorbing their information, we were there, we were present. We also made flyers where we'd leave in churches, different local organizations, just to, because not everybody's on social media. Maybe not everybody's getting the paper. Everybody may not be listening to the radio, but if they're showing up to the libraries or the churches or different neighborhood activities, our flyers were there, we were present, and the information was there and readily available for them.
Sounds like you were very busy and had a lot of output.
We did.
And it also sounds like you used a mix of social and traditional media. Do you want to tell us a little bit about why that decision was made?
Again, people want to be communicated to in different ways. It's also maybe like a generational thing. I know for myself, my age demographic is a lot like on Facebook, more so than we might be like on X. But the younger folks are on X, getting their information from there. And then not everybody has a social media account or wants to be on there. We even have some members of the Black Equity Coalition that weren't on social media. So how are they getting their information? And asking questions kind of led us to decide that maybe we should be on the radio, we should be showing up in the newspaper.
I think of the one project that we did, which was even just taking pictures with Santa and the families and how they heard about it, and being out there in the community and having that access to be able to get a family portrait now with Santa. It was just absolutely thrilling to see how the community really took on to these different pieces and really loved them and thanked us for them as well. So we know we were reaching the population that we wanted to. At the same time, being able to share it on all different pieces, from digital media with Soul Pit, one of the local people, and then in the newspapers, whereas people were talking about Black Equity Coalition and seeing what we were doing all over the place. So we got a really good feel for what was happening. And even at our vaccine events, asking that question, where did you find out about it, really gave us a lot more, input that this was working for us. And we were very grateful for that opportunity.
So looking back on your project, what were 2 or 3 of the biggest lessons that you guys learned through this work?
One, I would really say one of the biggest lessons that we learned is that communication is extremely important whenever you are doing projects. And you have to have a great marketing budget to be able to access and get it out to the community. And that's, our target is always for the community, but we also want to make sure that they can see themselves, like Monica said, in the project, so they can also communicate and respond and be a part of the process along with us. So that was one of the lessons that I learned.
So in closing, do you think that the findings from this project will influence the future work of the coalition? And if so, how?
I can say it's already changed it. Being able to have this initiative and work it through the communication and media pieces has created more opportunities for the Black Equity Coalition, not only locally, but nationally, to be seen. And we are receiving additional grants through different things.
I think with the messaging being timely, with it being relevant, and again, with us pulling community members into the ads, really added to the messaging and really driving home the point. And then there's still continued engagement. And again, more collaborators have come forward and been like, hey, we like your messaging. Maybe we can do something together, which again, I think is a powerful piece.
Well, that's great. Thank you both, Ayana and Monica, for joining us today. Fascinating to hear about your work, and we're really excited to share it with the broader community. Thanks again.
Thank you.
That's just a snapshot of the incredible work grantees completed under this grant. Through this project, grantees had the opportunities to test and evaluate their outreach and access strategies and document and reinforce the evidence base of what works. Thus, grantees strengthened their capacity to design many evaluations and collect and analyze data.
Thank you to all the grantees who shared their time, experiences, and findings with us and made this project possible. If you'd like to learn more about the efforts and accomplishments of the organizations, please check out our report, Building the Evidence Base for Advancing Vaccine Equity, on the Urban Institute website. Thanks very much for tuning in.